So implementation science. To start with, I'm going to show you some results from a survey we did of people attending the conference today. So maybe some of you guys, and also generally to IES members. And we asked them how confident they were that when implementing environmental policies, they were working to good practice. So you can see, of course, there's actually really positive response. Over 60% said they were confident, over 20% said they were very confident, and no one at all said they were not at all confident. So when me and the rest of the implementation science working group, some of whom you'll meet in a bit, looked at this result, the question that we had was, well, how do we know that we're working to good practice when implementing environmental policies? You know, is this just a sense that we have, or is there a science to it? What resources, skills, knowledge, tools, frameworks are we drawing on when implementing? And feel free to put those in the chat, because I'd love to hear about them. And we weren't sure from our experience in talking to practitioners and policymakers that the environmental sector did have clear evidence-informed good practice when it comes to implementation. For instance, we don't have if you know about the What Works Centres network, there's not a What Works Centre for the environment, for instance. So, which takes us to implementation science. And I think this will be the number one question for most of you in this workshop. What on earth is implementation science? And next slide, please, Sean. Indeed, the same survey shows that nearly half of respondents had never heard of implementation science and only 5% had used it. So hopefully we can change those numbers a bit today. Next slide. So implementation science is a field of study which seeks to scientifically and systematically understand the factors that lead to successful environmental policy. Sean, if you could just click to get the text up. Great, thank you. The study originated and is still predominantly based within healthcare, emerging in the 1990s as the sector looked for how to improve and speed up the adoption of clinical research findings into practice. So that's the kind of headline, but luckily we have Ioannis with us today, who's one of our implementation science working group members, and who is now going to give you a much deeper understanding of implementation science, drawing from his work in the healthcare space. After Ioannis has done this, I'm going to talk to you about EPIC's implementation science project and go through and get your opinion about what type of implementation support you think would be most useful for EPIC to produce. But Sean, if you can stop sharing my slides for now, and we'll get Ioannis to share his. And to introduce Ioannis properly, Ioannis Bakolis is a professor of public health, mental health and statistics, and deputy director of the Centre for Implementation Science at the Institute of Psychiatry, Psychology and Neuroscience, King's College London. Professor Bakolis's programme of multidisciplinary research aims to inform public health policy and clinical decision-making on how climate and environmental stresses and other forms of social adversity affect population mental and physical health. Ioannis is an international expert on how to best design, evaluate, implement, and scale up population health interventions and clinical trials in healthcare and community settings worldwide. His research has received over 25 million of funding from the Wellcome Trust, UKRI, Health Foundation, JDRF International and Maudsley Charity, and has been disseminated in over 150 publications to date. So we're very lucky to have him give us a bit of an introduction to what implementation science is. So over to you, Ioannis.
Thank you very much for your very, very kind introduction. So my name is Ioannis Bakolis. I'm a professor of public mental health and statistics, and I'm based at King's College London. And I've been asked today to provide kind of an overview of what we mean by implementation science. So I'll try to make a little bit the case of implementation science. And I've been asked as well to provide an example from the healthcare kind of services research field. However, I mean, like at the end of the presentation, I'll try to adapt it more of how we can use that when we are evaluating and when we are evaluating the effectiveness of implementation environmental related policies as well. But before we do all this, I would like to tell you a story. So this is a story that started in an operating theater room. And this is the story of the World Health Organization surgical checklist. It's probably one of the stories that actually make more emerge in the field of implementation science. And the World Health Organization surgical checklist was introduced for patient safety, and it's like kind of a simple approach. So it's a checklist that a surgeon will have before and during a surgical procedure, and will tick all the relevant kind of elements that he needs to consider during before and after the operation. So it's a very easy to implement. It's something that you can do in a very few minutes, and and the reason for that is not only to increase patient safety, but also to reduce surgical complications. The first study around the effectiveness of the surgical safety checklist was taking place in 2009. It was a kind of a worldwide study, having centers from different countries. And the first results that were published at the New England Journal of Medicine show that the surgical safety checklist, when was compared with kind of practice as usual, reduced major complication rates in patients by 36%, mortality decreased by 47%, and the post-operative infection decreased also by 48%. So some kind of large and significant clinical difference and some significant effects on the surgical safety checklist. And this taken by storm. So within weeks of publication, this became a national policy across the UK, and all hospitals were asked to implement the checklist within 12 months. So this is something that usually doesn't happen in healthcare. Something that was evidence-based could actually be rolled out and implemented very quickly within a national health service system. And there were further evidence around the effect of the WHO surgical checklist on patient outcomes, and there was a randomized control trial as well that kind of replicated the clinical significant differences that we're seeing in terms of the effectiveness of the surgical safety checklist. And again, there was a big reductions in complications, big reductions in mortality, and in post-operative procedures. And when this was trying to implement it at scale for the first time, this was we're trying to introduce the surgical safety checklist within all hospitals and within Ontario, Canada, so in a quite wide area, and large number of patients take into place, because, as we say, there was like kind of a population level type of implementation of the surgical safety checklist. The 30-day mortality that was observed pre-introduction of the checklist, when it was compared again with treatment with surgery as usual, was 0.71%, and post the checklist was 0.65%. The complication risk pre-implementation of the checklist was 3.86%, and after 3.82%, which is very minimal differences. So there was no any statistical significant difference using the checklist over pre and post period, and it was quite different from what was the findings that were coming from the previous research that was observed. So how can we have findings from a randomized control trial and findings from a kind of a worldwide observational study? And when we are actually trying to implement it at scale, what happened there? And the likely reason for the failure of that was not actually used. And the reason for that was that there was a variation on the implementations that happened within the different surgeries. So, for example, there was a variation in length of time that they were using the checklist, on the percentage of items that they were checking during the surgery procedure. and how much it was introduced to the patients while and before and during the surgery. And some kind of more qualitative evidence that were coming at how much variable was the implementation at the executive level, but also at a kind of more granular nurse and doctors and other people, healthcare providers that were working in the hospital, was the theme from the qualitative work that happened was related to the fact that it was just appeared. It was something they were just doing for one day, and it was something that the staff felt that it was forced to use to them without actually being informed beforehand or being engaged or co-design the checklist. And this is not a new story, and this is kind of the case for the implementation science. We know that from when it comes from evidence research, evidence-based research, for example, from the development of the first phases of an RCT to when things are actually being implemented and being rolled out in routine healthcare practice, the gap that we have between actual research and real life, as was estimated from a paper in 2011, is a 17-year gap. And according to recent findings as well, we don't seem that this gap has been reduced within the last years. And this is not surprising, knowing how much is the time that it takes for example, to set up a randomized controlled trial, run the whole kind of phases of randomized controlled trial and actually disseminate the results, and how much it takes to actually this become routine healthcare practice within a national healthcare system. So the whole purpose of implementation science is to actually bridge two worlds, is to bridge a world of research, where, for example, the intention is to maximize intervention efficacy, where there is a careful selection of patients, where they're specially trained, and there is a lot of funding in place to deliver the intervention or the policy. And on the health services research world, which the intention is not that, the intention is to achieve sustainable delivery, widespread adoption. The practitioners that will run that, they will not be trained to use the list, and obviously we have limited funding. And because of that, I think because there's 17 years of gap that we have between research and actually routine healthcare practice, we're kind of lost in translation, like Bill Murray in this picture. And that's what we're aiming to do with implementation science. We aim, as Ellie said before in one of the definitions, we aim to close that gap. So the implementation science journal definition, for example, is that they define implementation science as the scientific study of methods to promote the uptake of recent research findings into routine healthcare practice. The National Institute of Health Research in the US defines implementation science as innovative approaches to identify, understand, and overcome barriers to the adoption, adaptation, integration, and scale-up and sustainability of evidence-based interventions, tools, policies, and guidelines. This is a kind of a more wider definition. So a kind of a definition that might work within what we are trying to do within the group, within the implementation science group, but as well that can encompass a little bit more the transitional and transferable aspects of implementation science, is that is like a type of a health policy and systems research concerned with the study of clinical and public health policies, programs, and practices, with the best intent to understand not only what is and what isn't working, so what is effective and what is not effective, but how and why implementation is going to be right or wrong, and to test these approaches to improve the implementation. And there are different implementation research terms that a lot of people actually might use in their everyday life, but they don't have the systematically systematically way of identifying them. So we have different implementation strategies of how methods and techniques can be used to enhance the adoption, implementation, and sustainability of a policy. We have different implementation theories of framework. And we have different implementation contexts. And I think we touched a little bit about that around the barriers and the facilitators that could lead to a successful implementation of a policy, of a healthcare intervention, or a health service, a clinical program. And the key to the implementation research in order to make things more successful is like how you're engaging your different stakeholders that you're aiming to tailor your policy or your healthcare interventions. So there's a kind of wide consideration of stakeholders that they will start from implementers, policymakers, funders, to researchers and patients and service users. And also and this is kind of a more like in a kind of decade emerging field, think a little bit more when you're designing a research study, not only in terms of how effective might be your policy or your healthcare intervention, but also how implementable can be. And there are these development of new type of hybrid studies, type of designs, where based on the amount of evidence that you have if a policy or a healthcare intervention works, you could look at you can look more at the clinical effectiveness of the intervention, for example, or more to the testing implementation strategies if you have enough evidence that the policy is working in different contexts. And I know that up to now, I'm discussing the framework as something that it leads from intervention development to policy action. But usually what we have in real life is that we have already a policy that is being rolled out within a city, within a borough, or within a healthcare system, because commissioners are really believing in this policy, or politicians or mayors. And then this takes, and then we are not able to provide the evidence, but we need to provide the evidence a little bit ad hoc. So we need to evaluate the assessment of the policy, and we need to think different about the evaluation. So this kind of hybrid type of thinking could actually help not only on the traditional path route of we develop in a policy or intervention, we test its effectiveness, and then we translate into policy, but already with existing policy of how we will be able to evaluate all this, evaluate the effectiveness and the implementation of the policy, and also how we can make it more generalizable in different types of settings. And I'm in the last, I think, probably like 3-4 years, it starts to receive traction more kind of environmental related policy. This is a publication from Lancet Planetary Health on how we can advance climate change health adaptation through implementation science. And it mentions all the 4 different types of pillars that I briefly touched before. On how to identify stakeholders, how we can incorporate implementation strategies, how we can tailor it, how we can test for barriers and facilitators, and how we can look at dual effectiveness and implementation of a policy or a healthcare intervention. And this is something that we are trying to, this is something that we're actually working with my team at the moment in relation to the implementation of the ultra low emission zones in London. And we are trying to look at that in relation to population mental health. There's already ongoing work around the evaluation of ultra-low emission zones in relation to cardiorespiratory health. We are interested more on what will be the impact and the effectiveness of the ultra-low emission zones in relation to population mental health and health service use. And this is derived from some seminal publications that came from our team, that we did some epidemiological work trying to link, which linked air pollution with population mental health service use, and multimorbidity. And within that, we are looking by using electronic health records on the rapid evaluation of the ultra-low emission zone in terms of the effectiveness of the policy, and we have a reduction in terms of health service use, but reduction in terms of symptoms as well on the population level. But also as well, we're looking at the implementation of the policy tailored in relation to patients who are attending psychiatric services, to psychiatrists and to other different stakeholders and commissioners within the psychiatric hospital that we are operating, the Maudsley Hospital, in order to understand better the policy. And as I said, the implementation science, just to summarize, offers a language and a way of thinking, and most of the people probably already doing much of the things that I mentioned. And how we can translate things from interventions to the real world is a complementary perspective to traditional effectiveness research. And we are aiming to capture how well an intervention is being implemented and how to tailor different strategies, because different strategies will not be equally useful or applicable. So it's a little bit of tailor your implementation, evaluation, and approach according to the needs of your study. And this is some tools and some workshops that we run we have developed, and some workshops that we run within the center on people that are more interested to learn more about implementation science. So we have developed an Impress tool about how to conduct successful implementation research. Thank you very much. I know it was a lot to cover and take in. I hope that I can cover more in your questions. I'll stop sharing.
Thank you very much, Ioannis. I hope that's made implementation science, which, I think can just seem very abstract, a bit more real for people. If anyone has any specific questions for Ioannis, can you put them in the chat? And we'll try and come back to them at the end if we have time. Ioannis, of course, you can also keep an eye on the chat and just try and answer some of the questions while I'm speaking if you wish. But for now, I'll go back to my presentation. And I can see lots of thanks coming in from the chat. Yeah, brilliant. Thank you. Thanks, Sean. Great. So next slide. So Ioannis has talked about his implementation science work and implementation science in healthcare, really. So EPIC's implementation science project, what are we doing talking about implementation science? Well, the clue is in our name. We are the environmental policy implementation community. And as well as having work streams in looking into specific delivery challenges, like we're going to talk about biodiversity net gain later, a key and ongoing focus for the community is understanding and sharing best practice when it comes to the implementation of environmental policy. So this project is looking at how we can use implementation science, how we can adapt it, as well as traditional policy implementation and evaluation studies. How can we use the evidence that's out there to ensure that policy is being created with implementation in mind, and practitioners have the skills and resources they need to work to good practice when implementing. And the project is being guided by a working group. You've already heard from Ioannis, who is one working group member, and you'll hear from another one of our working group members, Andy, about his work later on in the session. So we started this project by asking the question, is there a need for support? Is there a need for implementation support, if you will? So we produced a problem statement at the start of this year and had discussions with experts, including one-on-ones and an expert focus group. And, I think we've got past this stage now. We can say that the answer is yes. That's not what we'll be talking about today. But then we moved on to what support can EPIC give? So, Sean, if you click. What are the options, basically? So we produced a discussion paper that looked into this, and we also conducted a review of the support that what work centres provide in their respective fields to give us kind of an array of different options. So now we've kind of moved on to what do our members want stage. So obviously we're doing this work not just, for our members. We hope it will be of use to kind of wider environmental community at large, but what do our members want? And we've done this kind of through the survey that I talked about at the start of this workshop. And also we're hoping to do this through this workshop right now. We're hoping to work out what you guys think in answer to this question. And then finally, of course, we will also have to produce whatever type of support our members want and need, and is also practical and viable for EPIC to produce. And to give you an idea of kind of timescales, this will likely be our key work stream for 2025. But as I said, I think, implementation best practice is going to be kind of an ongoing work stream of EPIC. It's really integral to our work. So next slide. So as I've said, from our work so far, we have come to a consensus that there is a need for implementation support, both at the practitioner and at the policymaker level. And also that there is an urgency to this support. We're all aware that successful implementation in this case means achieving the environmental outcomes we desperately need for our communities and our natural world. And I think especially now that we have a new government with a new kind of programme, making sure that these environmental policies, these new environmental policies, are actually achieving the impacts that they're supposed to, is really important. And it's important to get that done and put structures in place sooner rather than later. And we've also come to some principles. Our implementation support should be practical and usable for our members and others. We don't want a great big academic text that no one reads. And, you know, there's also no need for us to produce another framework, another implementation science framework. There are already over 100 out there. Oh, Jacob, I can see you've raised your hands. If we could just take any questions, maybe if you just put it in the chat, or maybe I can take one at the end. Thanks. And also the second principle is that it should take into account the complex and political nature of environmental systems and policy. You know, we can't just transplant implementation science approaches used in healthcare, maybe in like a hospital setting, to the environment, which is often, you know, we're dealing with really like complex different systems. We're dealing with maybe a lot more politics. It's not the same. We need to consider how they need to be adapted. So next slide, please. So what could or what should the implementation support that EPIC provides look like? So from our research, we are kind of coming to you with 7 different options. So evidence summaries, implementation guidance, implementation tools, case studies, discussion spaces, and training and direct support. And I think the first thing to say before I go into these in more detail is there really is an initial large piece of work lurking behind all of these, like some horrible iceberg, lurking behind all of these different options, which is a review of evidence on implementation in environmental policy. So drawing from integrating evidence from implementation science, policy implementation studies, and evaluation studies to ensure that any one of these outputs, if we chose to do them, is evidence informed. Luckily, a lot of all that information is already out there, but just to kind of flag that up, that, you know, obviously that work would need to be done before we produce any of these kind of outputs. So bearing that in mind, I'm going to go through them each in turn, and I'm going to invite you. Obviously, it would have been great to have like breakout rooms, but there's too many of you, so I'm going to try and invite you to comment on them as I do so. And we're going to go back to everyone's new favorite platform, WooClap. So I'm just going to post a link to a new one in the chat. So hopefully that should, if you click on that link, it should take you up to a page. I can share my screen briefly. Should take you to a page where you've got different boards. Like I said, there's 6 or 7 different options. And what you can do as I go through each one, you should be able to write a post-it note and post on the different boards in terms of, what do you think of this output? Do you think it's useful? Do you think maybe there's already people doing this elsewhere and it wouldn't be that like useful for EPIC to do? What are the kind of drawbacks? How would you see yourself using it? Do you actually see yourself reaching for it, in what circumstances? And what adaptations, compared to maybe the specific examples I'm going to show you, would there need to be? Those kinds of comments, please. And you can also, you should be able to like other people's, like we did previously. So Sean, if we just go back to my slides. Yeah, so we'll look slightly different to my screen share, but overall, when we come back to it at the end, that's what we should see. We should see a nice board with different post-it notes on it. Okay, thank you. Great. And also, if you like a specific example I'm showing you, also if you make a note of that as well, that'd be great. So I'm going to turn to our first output, which is evidence summaries. These are short, relatively simple briefings on what works, drawing on the best available evidence. So for these types of summaries, evidence on what works in implementation is one part, but it's not necessarily the focus. So you can see this example is on prison discharge and homelessness from the Centre for Homelessness Impact, but you can imagine it might be what works on changing public behaviours on environmental issues, kind of aimed for like maybe local authorities, that kind of things. And if we go to the next slide, here's another example of what an evidence summary might look like from the Youth Futures Foundation. Here they have a summary page summarising the evidence on different interventions designed to achieve youth employment goals. And if you click through, say if you clicked on the job training, and Sian just click to the next slide, they have more detailed information, including a whole section you can see on the left-hand side here, a section on the evidence on how to implement it well. So that's kind of the first option, maybe not too dissimilar from kind of other briefings that you might have seen. So now we're going on to our second option, which is implementation guidance. And obviously a reminder, do put your post-it notes, do be posting your post-it notes as I'm talking through these. But yeah, so onto implementation guidance. So this output is more focused on implementation. This example is from the Education Endowment Foundation, and it sets out 3 key elements for successful implementation. So kind of 2 building blocks, which are behaviours and contextual factors that underpin implementation and should be infused into educators' day-to-day work. And then the kind of building block on top, having a process to actually enact implementation. So this guide goes through how to achieve these 3 blocks. And of course, it is targeted at a specific setting, so schools. So you could see potentially EPIC might produce guides to implementation for different settings or different actors. Again, I go back to local authorities because it's an easy example, and we do have a lot of local authority members, but a local authority's guide to implementation, perhaps. Next slide, please. So now we're going to look at implementation tools. And the tools in this example actually kind of come with the previous guidance. So I guess that's a point to note about these different outputs. It's not necessarily a one or the other. Some of them might be really complementary. But yeah, obviously we need to think about like our EPIC's capacity, and maybe we can do one thing to start with and kind of build on. So these tools are typically kind of exercises that you can work through with your colleagues. So for instance, next slide, here we have a structured template implementation plan, or it might be, next slide, a checklist. It's interesting, I think Ioannis has kind of shown us like at the high level you have all of these papers, and then essentially Ioannis also said you're probably doing a lot of this already yourselves, naturally, and these kind of when it comes to like the day-to-day, these kind of just like it might just come down to a checklist. And next slide. Or it might be a kind of illustrative implementation scenario, like a little vignette, which you then have some questions to work through in terms of what would you do in this situation, etc., etc. So another thing that kind of might sit under implementation tools is a diagnostic tool to enable people to interrogate and understand the situations they find themselves in. And so we're able to kind of pick which implementation strategies or frameworks, questions, whatever you want to call them, that they might need to use. So yeah, next I'm going to move on to case studies, and I'll be pretty quick here. I think we all know what case studies are and how helpful they can be, but of course not all case studies are equal. So I would be envisioning if EPIC was to kind of focus on this as our output, it would be producing a bank of case studies. Here you've got an example from the College of Policing that really focus on the learnings from implementation. So next slide, you can see here, that's from clicking on one of those case studies, and they have a really big kind of section on learning from implementation. So penultimately, our penultimate output is what we're calling discussion spaces. It's essentially providing spaces for peer-to-peer peer support discussions where, you know, no one's judging each other. They're all there as equals to share experiences and describe situations that they face themselves that might have relevance for others in their own situations. Of course, like facilitated by an implementation expert. Or even it could be, instead of peer-to-peer, trying to bring in maybe your practitioners with maybe an arm's length body or government officials, so someone from like higher up the policy chain with someone a bit like lower down the policy stream, and trying to have like an open discussion about what's working, what's not working, though obviously that could be a bit more difficult. And then for our final output, which we're calling training and direct support, I'm going to hand over to another one of our task group members, Andy, to kind of give a good overview of this option, because it's based on his own work that he's been doing. So Sian, if you stop sharing my screen, thank you. And Andy, you should be able to share your slides. While Andy's getting up his slides, I'll just give him a proper introduction. So Andy is a senior project specialist in the Centre for Effective Services, where he works on implementation, practice and service development. Andy joined SES with a vision to improve the use of implementation practice to improve outcomes across a range of service areas. With a background in youth justice, Andy has worked in both statutory and voluntary sector organisations, where he was involved with service management and service and practice development. While with SES, Andy has worked with HIQA, Respond and the Irish Prison Service to build capacity and implementation, as well as design new services. So over to you, Andy. Oh, Andy, I can't hear you. Can anyone else hear Andy, or is that just me? Yeah, we can't hear you, Andy. You are, I can see that you're unmuted. Yeah, if you try taking your headphones off.
Yeah, put the headphones out. That's
yeah,
good.
Perfect. I can hear you now.
So I'll start again. Thanks, everybody. It's great to be here to talk about the practical applications of implementation science, and also some of the capacity building work that we do at CES. The Centre for Effective Services, just very quickly, is a not-for-profit. We work in the voluntary and government sectors here in Ireland. We've offices in Belfast and Dublin. I'm based in our Dublin office, and we do a number of things. We do implementation is our primary piece, but we also do research and evaluation and kind of strategy work and things like that. So we're very much what we call knowledge translators, or doing knowledge brokering, especially in relation to implementation. So I'm going to talk about two pieces today. This first piece is a piece of work that we did, that I led a team on, with what we call an approved housing body here, so in the housing association called Respond, which is a charity. And then I'm going to talk about some capacity and capability work that we're doing, and it's ongoing with 3 universities here across the island of Ireland, that is focused on improving impact of research in relation to policy implementation. Okay, so I'll start off with this piece here, these very nice colourful slides here. So we were asked by this group, this housing body, Respond, initially to look at antisocial behaviour and to come up with a plan that we would help them implement to reduce antisocial behaviour. Basically, what happened when we went in and we started to do our initial research and to engage with staff and with the tenants, is that we found it wasn't actually an issue with antisocial behaviour. Antisocial behaviour was quite low, actually, and in the areas that we'd expect it. So with a lot of apartments or flat complexes on their housing estate, we found that, most of the antisocial behaviour was in wide open green spaces, and most of the complaints came from lower floor, bottom floor tenants. So not unexpected, but what did come out across the range of the consultation pieces we did was that there was this issue with tenant engagement. So we went in to look at how we could develop this kind of systematic evidence-informed model of working with all for the service with all tenants, which gave the kind of clarity and flexibility to tailor approaches to individual needs. And just to sum that up, I suppose this is a national organisation, and we were going to look so that they could provide, instead of a national response and a one-size-fits-all, we had a strap line of national service, local response. So have a look at how we did that. So initially we ran a number of what we call service design workshops with staff to look at how they currently engage the tenants, what the enablers and barriers were to engagement. We ran some logic modelling workshops. We called them road mapping, because we're working with practitioners, and we find that technical terms and stuff like that, they've just got too much on to take those all on board. So we call that road mapping. We're looking at where you're at and where you want to be, what you're going to do to achieve it, and what resources you've got or that you need to do that. We then, like I say, we carried out we had an idea of a service. We carried out some service design workshops where we looked to see if the various models that we had in mind would work with them and sense check the design. Fortunately, that came back as being okay. And we, in a kind of major shift, we recommended that they move from a hierarchical structure down to a devolved structure of working, where the individual teams on the housing estates and developments would have a lot more autonomy than they had already in terms of holding things like budgets and deciding what services were required in their own individual estates. And this boils down for us to a big piece in implementation, which is all about context. I know Ioannis had hinted at that. You just can't take one service and roll it out in one area and then expect it to, because it's worked there, expect it to work somewhere else. And there are various, again, once you get into the implementation science side, you'll find there's some tools and theories, models and frameworks that help us to look and explore context. We also did some tenant interviews, some stakeholder engagement interviews, and some evidence review. Looked at the literature, both the grey literature and the academic literature in and around tenant engagement, things like that. This was quite a lengthy process. And this is, I suppose, a lesson in terms of, or an understanding of implementation, is that it's not a quick and easy job to do. It takes time. It takes a bit of research. It takes a bit of sitting down with people and talking and then analysing in that stuff. And we very much look at it from our perspective as a kind of almost like that for initial pieces. It's like a research project. We're gathering the evidence so we can then move forward with the implementation. So what did the implementation consist of? In this case, we're at CES, we're a firm believer in capacity building, capacity and capability building, actually, because it's one thing to go and give somebody a training program and talk to them about how they should implement something, but actually it's another thing for them to feel confident that they're able to do it. So these are some of the key areas that came up for us in terms of what we needed to train them on and talk to them about, and some of the statements, and hopefully we can share these slides out wider later on. After this, you'll get a chance to read them. I'm not going to run through now because we just haven't got the time, really. So we've built capacity and capability, provided support and technical input. And the way that we did that was we helped to we helped with building local implementation teams in each of the housing areas. We identified implementation sites, what we called micro implementation sites. And the idea here was to have a really kind of agile implementation where we would roll it out in one area. This model of devolved team working, we'd roll it out in one area. And then we would let that run for a few months and have our feedback loop set up so we could see what was working and what wasn't working, and be able to tweak it and adjust it. as we moved on. And after 3 or 4 months, the idea is then that with Respond, we would roll it out into another area and just keep that process going. So it was a constant kind of learning around it in terms of that kind of monitoring and adjusting the implementation plan. And we, by doing this as well, by kind of rolling this out in stages and these kind of micro implementation sites, we ensured that there was momentum and sustainability, because there was always an activity going on. And one of the pieces that we're very aware of, and again, it's a broader implementation piece, is that you can roll out a program, you can implement it, and you can go back 6 months later and find that the innovation or the intervention that you've implemented, people aren't using it because they've kind of lost the momentum of it, or they have just reverted back to their old practices. So those were some of the activities that we did. We trained up a kind of overarching implementation team, and then we trained the local implementation teams, and we supported them in a mentoring way, a mentoring role really of, and with the implementation plan, we would come back now and again or meet them on a regular enough basis and discuss about how the implementation was going, and if they had any problems or roadblocks, we'd coach them through, we'd coach Respond through how they could get that going on. So in terms of time, this project started back in 2020, and they are still implementing as we speak now. It just takes time for this to become fully embedded. But it is getting there. That's the good thing. And as the time has gone on, our kind of help and support has been less and less required. So it's a very, very light touch now at the moment. And what we've got is hopefully is an improved service, which is the results that they're finding through their surveys with their tenants, that we've increased the responsibility and the training or capacity and capability of the staff in relation to implementation. So we've now got a workforce that are also able to implement other projects. So there's been a kind of a knock-on effect of doing this training. So if they want to implement stuff on a local level, they've now got the capacity and the capability to do that. So overall, it's just, for us, it was one of our shining examples of how this implementation piece has worked in terms of the implementation support. And it's a very kind of direct piece of support where we've been basically working with our organization for about four years now. So what came out of that? I suppose what really worked for me was we took the knowledge translation, we aligned the values of tenants and staff and all the other stakeholders, and it really landed us with an increased chance of success. And I think that values alignment is really important. And it's something, as we get into implementation science, it's becoming more and more important, is about this idea of values-led implementation, where we used to be very, very, very technical around implementation science, and it can still be very academic and still kind of, there's a lot of literature in and around the subject. And more now, there's more literature around this, about the idea of values and relationships building within implementation. And certainly at this kind of lower level of implementation, where we're at the cold face or the front line, then that relationship building is really important. And if we haven't got those relationships, what we find is, and there is evidence to support this by Alison Metz and at the University of North Carolina, is that your implementation is less likely to succeed. So those are our, like I say, those are our key drivers, that kind of idea of knowledge translation and values alignment. As I said, it was, in and around relationships, trust, and this idea of co-production and collaboration. And I think just on this last point about co-production and collaboration is we've got to be really clear at the outset of these implementation exercises what we mean by co-production and collaboration, and the same with co-creation. And depending on the level, this is just my experience, depending on the level that we're working at, sometimes the capacity for doing that is limited. So if we've got a policy, for example, a policy level implementation, there is very little. There is collaboration and there's consultation at policy level, especially at government level. But actually, I find sometimes that the co-production is limited. there'll be an idea or a policy idea, and it's just going to go ahead and get implemented. So we just have to be careful and define what we mean about co-production and collaboration, and be careful around our language there. Cool. Okay, so this next example I'm going to talk about very briefly is about building implementation capacity with academics. You can see the logos there at the bottom. There was a few bodies involved here. This came as a part of a HEA, or Higher Education Authority funding call. There's a cross-border call here in Ireland that brings together the University of Limerick and Queen's University in Belfast to research in and around youth justice. And the idea is to look at what youth justice programs are effective, which ones are being used in the Southern Ireland that work, the ones that are being used in Northern Ireland that work, see if there's any kind of crossover, but also look at the implementation of those and how those can be implemented. So there's a number of pieces of work going on. There's some practical implementation going on. There's a big piece of research that we're currently doing about policy implementation, where we've spoken to a range of policy stakeholders north and south of the border, around 20 to 30 at this time, where we've interviewed, and we're looking at how we can, what enablers and barriers and what lessons we can pull out of those interviews to see how policy can be implemented. And just very briefly, a recent OECD report about governance in Ireland, or government in Ireland, pointed out that implementers should be involved at the earliest stages of policy formation. So this key piece that I'm involved in here is around implementation training that builds and strengthens the capacity to use implementation science in people's work. The focus was to look at implementation research in the context of designing and conducting research and evaluation studies. And it focuses on the fundamentals of that kind of good scientific practice regarding implementation research, which is grounded in the key theories, models, and frameworks that we have. I know Ellie mentioned that there are a lot. There was, over the last count, there was over 107 theories, models, or frameworks available to use in implementation science. And a lot of them, I have to be honest, are just where somebody's adapted a model or a framework slightly to fit in with their own program, and they've just given it a new name. But we always come back. This is just a reassuring piece, I suppose. We always come back to using, certainly in CS, we have 7 theories, models, or frameworks that we use all the time. We also wanted to put a focus on how implementation science can promote and support the impact, research impact, in terms of at that kind of research to policy level. It was a little bit different because I know in Queen's they have the ref that they have to work to, whereas in Ireland we don't have in Southern Ireland there's no framework in and around that kind of research impact. And just to add, this was a multidisciplinary group of academics, so from a range of different disciplines: health, education, engineering, social care, social care and social sciences. So a wide range. So we've divided this into 3 key areas. We conducted an introduction to implementation science. We then had an applied module in implementation science, or applied program, and we're just going into this mastery phase now, and I'll explain those in a little bit more detail. And we were aiming to increase the use of implementation science within their work, whether that was in terms of evaluating interventions that have been carried out under their particular discipline, or whether it was even thinking about using some of the tools or theories, models, and frameworks from implementation to support their grant writing and funding. So what was our approach? So the intro was 6 sessions, 3 hours each. It was online. There was 60% of it was formal input, 40% was discussion, and we used a case study. The case study we used in the introduction was in and around the reduction of dog fouling on a housing estate. It was a kind of low-level piece, and the task was to evaluate the various measures that had been implemented to reduce dog fouling. So again, like I say, it was a multidisciplinary approach. We've ran that now 3 times, and every time we have a waiting list at the end of it. So it's a really kind of useful program, and it's well received. So we're happy with that. The next group is the applied group, and here's where we look to take some of the stuff we'd covered in the intro section and dive into it in a little bit more detail, and really get participants to start thinking about the application of it, how they could use it, and how it would be useful to them. So again, 6 sessions, 2 hours each this time, online again, so we've got maximum attendance. There's a 40% formal input on this and 60% discussion. And the case study here, we used the reduction or the removal of the plastic bags in Ireland, which was a really successful implementation here on a kind of population level or national level. It worked really well and was well received. So we used that as a case study to see how that worked, and applied some of these concepts to it. The mastery group, as we're calling it at the moment, I haven't really thought of a better name for it. It sounds, I don't want it to sound elitist, but it does a little bit. They're going to be 6 sessions, 2 hours. This will be mostly discussion and driven by the participants. And what we're hoping, and I think Ellie kind of talked about this earlier in her list of options, was that we will get people to come along with either an implementation question or an implementation issue that we'll discuss, or if there's no discussion, we might do like a journal article read, or just pose, as facilitators, pose a problem and ask the group then to discuss it and to see if they can come up with some solutions. Again, multidisciplinary. So we'll just have a quick look at some of the topics that we covered. In the intro, we looked at what is implementation science. We looked at the enablers, what are enablers and barriers and strategies, which Ioannis has already mentioned. And then we looked at the theories, models, and frameworks. We also touched on the evaluation side of implementation, which is an area that they were very interested in. And we also talked about how they could use some of these and adapt some of the theories, models, and frameworks and some of the tools to show research impact, or to think about their research, the research designs, and how that was going to impact on the communities or the participants of their research. In the applied piece, we looked at de-implementation, which is a kind of growing, it's been around for a bit, but it's a growing area of interest in implementation. We looked a bit deeper in stakeholder engagement. We started to think about systems thinking as a way of identifying stakeholders and looking at the relationships. We took a deeper dive into strategies, implementation strategies, by looking at how they can be adapted. We looked at leadership in implementation, and we also looked at evaluation in a bit more detail. And we looked also in terms of that in this rapid insight approach, which is designed, I think, by Wessex, ARCH, if I get that right, or AICH, one of the NHS university kind of partnerships. And we looked at that as a way of monitoring implementation progress. And as I said, in the mastery piece, this will be driven by the participants. There'll be theoretical and practical application, and there'll be case studies proposed by participants. So that's the end of it. I suppose the last thing is, if you are interested in implementation, there is the United Kingdom Implementation Society. They're always looking for members, and there are, I know, very few in relation to other disciplines, very few members of that who are from the kind of environmental sciences background or environment background. And there's also the European Implementation Collaborative, which is a European-wide implementation group that brings all the European networks, including the UK, together. And again, very little representation there in the environmental sciences area. And finally, thank you very much for listening. If there's any questions, I think they'll probably come in the chat, or they'll come at some point later on. There's a QR code there with my details. If you've got anything that you want to follow up with, feel free to email me and ask me anything, or have a chat or something like that. Thanks very much.
Thanks so much, Andy. Again, I think it's great to hear from you and Ioannis, because yeah, making implementation science actually real, you're actually doing it. And yeah, great example there. I think really ambitious in terms of, you know, if EPIC is thinking about what types of output or support it wants to produce for its members. I mean, basically, you've kind of presented on like a whole training module, which also includes some elements of the kind of discussion space I think we're talking about as well. But yeah, I'll pass over to Ruth now, because otherwise we will be quite behind. So Ruth.
Thanks very much, Ellie, and thanks to yourself, Ioannis and Andy, for really thought-provoking session. That was great.